I wanted to share my experience of the long case in the exam. I think it was very scary. I still remember the case which I got. I was very scared. So there was a lottery system. I got 2 cases. I was allotted bed number 2 and bed number 4. So the first case which I got, I went to the patient and I started taking the history, and I was totally shocked. The patient was a 22-year-old boy. He had just one complaint of movement like this. I was like, how to approach this? And I was trying to ask him, what other complaints you have? Do you have any other thing, whether you are able to walk or not, whether you have any bladder problem? Because from the first complaint I understood that it's a CNS case, but still I was trying to extract whether it's a hemiplegia, 22-year-old guy, no, whether it is a paraplegia, yes, you can get a paraplegia in 22-year-old, but then the history was not matching, and he just had one complaint that he had movement like this, and this movement has been increasing in intensity over 2 years, and he's unable to carry out his day-to-day activities. And I was totally shocked because I was having no idea how to frame the history, how to do the examination, what will I do, what are the differential diagnoses. Everything was running through my mind, but I was not able to catch thing of it. And we just got 10 to 15 minutes to do everything in detail. So I started, the reflexes, they were normal. I did all the cranial nerve examination, it is normal. I did the muscle power examination, everything was normal. He just had one complaint, which was a movement like this, and it started increasing in intensity. I was totally clean, but I did not have any idea what to do. And 10 minutes was gone in a flash. An examiner approached. The 2 examiners, both were externals, and they came and they asked me, what's your diagnosis? And I was totally silent. I was standing there, I had no idea what to say, and I'm just giving a blank look at their faces. And they are like, come on, tell us what's your diagnosis. And I'm like, so I don't know. And I was pretty sure that I will fail this exam, because I thought long cases, set up the good impression for the ward rounds in the Viva station also. And this was the first case, and I thought, since I don't know anything, I'll do very bad in the Viva and the whole exam is gone, everything, my mind got blocked and everything. But the examiner was kind enough. He just asked me, okay, forget about the diagnosis, present your case. So I had no idea about it, but still I started like, sir, the patient is 22-year-old male and he has complaints of the involuntary movement, which is regular in rhythm and moderate in intensity. It has started to increase with his activities over the 2 years and something like that. And I tried to, frame the history as in the patient's language with the negative history as possible. But then I understood this is a CNS case of a movement disorder, which generally we tend to ignore while preparing, because we generally prepare for hemiplegia, paraplegia and a peripheral neuropathy, but hardly we do prepare for movement disorders like Parkinson's or any other hyperkinetic movements or hypokinetic movements, and we generally don't tend to get cases so common also, and we don't practice the examination also. So at least I understood that this is an involuntary movement disorder case, so I presented in that way. So the examiner asked me, okay, now tell me your diagnosis. So I was totally scared, so I started blabbering anything which was coming to my mind, like chorea, Huntington's chorea, and then tremor, or anything which was coming in my mind. So the examiner was like, first you calm down, just tell us what are the involuntary movements, classify it. So I was able to classify it into the 5 different types which it is. So he just asked me what type of involuntary movement is this. I was able to say, so this is a tremor. So he asked me, how do you examine a tremor? So I asked the patient to do like this, and he was having this movement. Then the examiner asked me, there's a special method of testing a special type of tremor. Do you have any idea about it? And I was like, no sir. So examiner was very kind enough, and he knew maybe the case was difficult. So since I did this, so he asked the patient to do it like this, and the moment the patient did like this, the patient was having this type of movement. And the moment the patient started having one-sided this movement, something clicked in my mind, and I thought, I think this is wing beating tremor. So I immediately told the examiner, sir, I think this is wing beating tremor. And examiner then asked me, so then now what is your diagnosis? And it clicked my mind, 22-year-old guy, wing beating tremor, most likely it could be a Wilson's disease. And I told that, sir, it's a Wilson's disease case. And he was totally impressed, and from that moment my Viva changed. So it was a very difficult case, and can you believe it, I got a Wilson's disease case with a neurological manifestation in the form of wing beating tremor as a long case in my DNB practical examination. So that was totally unexpected. That's why I'm saying that you can get any case. You can get any case in your examination hall. You can't complain. You have to face it. And if it is a difficult case, examiners will also understand. and as I told you, they are not there to fail you, they are there to help you, as the examiner did in this case. He helped me identify the disease, and the moment I identified, the Viva changed, because I know about Wilson's, I have studied about Wilson's disease. And then he started asking me everything about Wilson's, like what is the genetic abnormality, what is the investigation you like to do, what is the management, and I was able to answer that. And then examiner was very happy. So that is how, you should be prepared for any worst case scenario. Of course, I was totally unaware of the case which I got. I had no idea about it, and I was totally sure that I am going to fail. But the way it turned out to be, the way examiner helped and the way I faced everything, I think that helped, and luckily I got through it.